Okay, we're going to be reviewing the basic strokes using the fascial abrasion technique tool and the rewind warming balm. So I'm going to demonstrate right now the proper position for the patient, as well as 3 basic strokes and how you perform each of the strokes. So you're going to use just a very, very little of this warming balm. The warming balm is designed specifically to help improve the friction or increase the friction between the textured surface of the tool and the surface of the skin. So if in an area where I don't have the cream, you can see how it just slides across really easily. When I put a very little small amount on, okay, you'll see that what happens is it now grabs the skin and it doesn't slide, so you can see it shaking the skin. So when you're working in an area where there's increased fascial tension or restricted mobility of the tissue, you're going to position the body part at about 70 degrees of its normal range of motion. Because if it's too tight, you're just going to slide over the surface of the skin. And if it's not tight enough, you're just going to be shaking the surface tissue loose. So basically, you're just going to bend, in this case, the knee, trying to work on the IT band, the lateral quad. Okay. So first, you're going to just use what's called a feathering stroke, just to just with the weight of the tool, and you move in different directions to identify which way it's restricted, which way the tissue is maximally restricted. So in this case, coming up this way, I feel the most restriction in mobility of the tissue. Okay, so once you've identified that, then you can use a sweeping stroke, which is now a longer stroke, and I keep tension. I'm holding the tool with my 4 fingers and my thumb down when I'm going away this way, and I'll flip the tool and put my finger here when I'm moving away in inferior direction. Okay, so now with a sweeping stroke, I'm going to put pressure on the tool in both directions, and I'm going to more clearly identify the direction of the increased tissue tension. So in this case, it's this right along this line here. So now the next stroke, which is the maximum treatment stroke, is called a burst stroke. So I'm going to start at the distal end of the tissue tension line, and I'm going to do quick strokes up and down with pressure on the tool in both directions along the length of the line of the tension. Okay, so in this case it's here, and you can start to see it's already starting to shake loose the tissue. So in cases like that, you're going to have to increase the tension by bending the knee a little bit farther, and at the same time hold the quad and hold the tissue so that it doesn't move as much. So this allows you to untangle and tease free the fascia that's underneath. Okay, so the most you should see is a light reddening of the skin. There should be no bruising or no petechia, and that's just from the surface scratching. Okay, the surface texture scratching the surface of the skin. Okay, and then once you've done that and you can start to feel it loosen up, you can scan for different areas. Use a sweeping stroke to scan for different areas, and then you're going to again use the burst stroke to loosen up the tissue and hold the fascia to help minimize the surface skin from loosening or from moving too much. That's it.